Well, this morning we are getting your questions answered about COVID-19, vaccines, anything related to this pandemic. And to help us out, we are at Millennium Physician Group in Charlotte County talking to Dr. Ruben Garcia. He is one of the doctors with Millennium Physician Group. And we are seeing that Governor DeSantis is rolling out these state-run clinics that are giving out the monoclonal antibody treatments for COVID-19 patients. Are you guys using those treatments? Are you seeing them being effective in helping people who do come down with COVID-19?
So right now, we are seeing some effectiveness with the monoclonal antibody treatments. Those are primarily outpatients. That's not approved for inpatient, for hospitalized patients. And we are seeing some effectiveness with that treatment for patients that have COVID-19.
So these are more for people who, of course, they're not on the ventilators, they're not having serious complications from COVID, but they're people who are dealing with more of the moderate symptoms.
Yes.
Okay, so things like a cough or maybe some chest pain, but nothing super major.
Yes, right now that's what we're seeing is for folks that are not sick enough to require hospitalization. There are some treatments that are still experimental for hospitalized patients, but that requires a lot more work with the FDA.
Gotcha. And another question that we're getting from our viewers is if this treatment is available to help people who come down with COVID-19 and it is effective, why should they still go and get the vaccine?
Why would you not want to be, as we would say, twice as ready for anything? For a good example would be twice as ready for a fight or anything else, as opposed to just rolling the dice with one treatment. So if you're vaccinated, you already have some antibodies. If you do get COVID and require monoclonal antibody treatment, then that effectively would help you get over your illness a little quicker and a little bit safer. So to me, it's a big gamble to not get vaccinated, just wait till you get COVID-19 and then get the monoclonal antibody treatment and hope that everything is effective and you can get through it without any issues.
Absolutely. Thank you so much for continuing to answer our questions this morning. We're going to check back in with Dr. Garcia in just a few minutes and continue to get your COVID-19 questions answered. But for now, Chris, I'll send it back inside to you.